Hey guys. Hi. I just wanted to do a little bit of a review about neurologic emergencies for our upcoming medical phys exam. So, strokes is the first thing I want to talk about. Stroke and a cerebral vascular accident, or CVA, those are the same thing. More the lay public calls it a stroke, although a lot of medical providers call it stroke too, but it means the same thing as a CVA, cerebral vascular accident. So there's two types of strokes. On my notes right here, you can see we've got hemorrhagic and ischemic embolic. So hemorrhagic stroke is really when there's a weakened area of the blood vessels, either the arterial or the venous or both, may have some kind of a malformation or a weakened area. And that area can rupture. And when the brain fills with blood, it's very, very painful, very irritating to the brain tissue. So the patient has a severe, really, really severe headache. And also the patient will, the cranium can only hold so much volume in addition to the brain. So you've got the brain and the cerebrospinal fluid, and when there's too much pressure in there or increased intracranial pressure, there's certain symptoms which can be high blood pressure, bradycardia, headache, um, but eventually that pressure starts moving the brainstem through the foramen magnum, which is that hole in the spinal cord. And when the brain herniates in through that hole because of too much pressure, that's right where the brainstem is. So you do see vital sign abnormalities. You see very high blood pressure and bradycardia, and it's really a reflex from the pressure in the brain and the herniation. So, a hemorrhagic stroke, first of all, is some kind of rupture of blood vessel typically, and the patient will say, "It is the worst headache of my life." And people can have a migraine and a very bad migraine and worst migraine of my life, but even people with severe headaches, severe migraines, when they have a hemorrhagic or an aneurysm rupture, it's a whole nother world of headache. It's extreme pain. So, worst headache of my life. And then ischemic embolic is usually caused by a blood clot or a piece of debris that's floating around and obstructs a blood vessel. And so ischemic, remember we learned in cardiovascular emergencies, ischemic is tissue death. Or the tissue doesn't get enough oxygen. So when the brain tissue doesn't get enough oxygen, you see signs of a stroke. Okay, so what are the symptoms of stroke? High blood pressure, sometimes bradycardia. We can have weakness or paralysis. And typically they're on one side, so half is hemi, so hemiparesis. So maybe one side of the body is weak or paralyzed. We can have slurred speech. We can have unequal pupils. You can have unequal pupils, and then as the brain, there's too much pressure in the brain. You have increased intracranial pressure, and the brain is pushing down, herniating through the foramen magnum. One of the cranial nerves, the third cranial nerve that controls your pupils, is right down there at the base of your brain, and there's pressure on there. It can cause your pupils to be fixed and dilated. Initially unequal, and then as the brain really puts more pressure on that nerve, they can be fixed and dilated. So what does that mean? They could be fixed, so dilated like at 4, 5 millimeters, 6 millimeters, and when you shine a pen light onto them, they don't react. So they don't go from 5 to 4 or 3 to 4. They stay the same. They're fixed and dilated. And some others, we could have headache and weakness. So a stroke, a TIA, so transient ischemic attack, is stroke type symptoms that resolve in 24 hours. So you might go to a patient's house and they have all the signs of a stroke, maybe slurred speech or face asymmetry or an arm drift. And as you're there or you're transporting to the hospital, maybe the symptoms start to resolve, or maybe once you get to the hospital they resolve, or within 24 hours. If the symptoms of a stroke resolve within 24 hours, it's transient, so it's called a transient ischemic attack. It is very serious. It is a sign that there's something really wrong and the patient needs a really comprehensive neurologic workup. So we do still take them to the hospital, but remember, a TIA is a transient ischemic attack and stroke symptoms resolve. So for the Cincinnati stroke score, the FAST score is called the Cincinnati stroke score, and that's what we test our patients to see if they're having a stroke. It's one of our exams that we do. You have to know all three of these. So first one, F is facial. Ask the patient to smile. So you say, smile really big for me. And the patient smiles, and we look for symmetry. Do the corners of the lips go up at the same time? Are the eyes equal? Asymmetry of the face may be like, so one side kind of goes down and the other side goes up. It's just not equal or symmetrical. The next one is the A is arms. So we ask the patient, hold your arms out, palms up, and hold them there, hold them there. And a patient that has a positive arm sign, you'll see their arm drift. So arms are up and then one arm will drift down. So that would be a positive. So a positive for a facial is an asymmetric style, smile really big and it's not equal. Positive for A arms is when you ask the palms up and you see an arm drift, that's positive. And speech is the last one. We want to check to see if the patient has slurred speech because that is a sign of a stroke, remember. So we ask them to repeat a familiar phrase. So one of the ones that are common that people ask is, you can't teach an old dog new tricks. So if you say, repeat after me, you can't teach an old dog new tricks. We're looking for if the speech is slurred, and also if they're repeating back the same thing to us. So if they say, you can't teach an old cookie new baking, they're not using the right words. Sometimes they think they're saying you can't teach an old dog new tricks, but what's coming out is abnormal words, like word salad. That's a sign of a stroke. Or if the speech is slurred, or some people can't talk at all. They just can't speak. If the speech part of their brain is affected by the stroke, if it's damaged. So speech, we ask them to repeat a common phrase. Some people say the sky is blue in Cincinnati. It's a common phrase and it's also the Cincinnati stroke score, or you can't teach an old dog new tricks. Okay, so let's talk about seizures. When you're going to a call on a patient with seizures, the first thing we do is we want to protect from harm. So we may, if the patient is like slumped in a chair seizing, or they're on a hard surface, we want to make sure they're not going to injure themselves. We're going to lay them flat on a floor and make sure they're not going to injure themselves. So in the case of a seizure, a patient's actively seizing, the number one is protecting from harm, and then we go to airway, breathing, circulation. So it's always airway, breathing, scene safety, airway, breathing, circulation, but sometimes things take precedence, and protecting from harm, making sure someone isn't banging their head or their limbs or are going to fall down the stairs or fall off a chair. Protect them from harm. There's two movements in a seizure. There's tonic and there's clonic. So tonic seizures is the stiffening part of the seizure, and the clonic is the jerking part of the seizure. And the only way I can think of, there's got to be some really good mnemonics. I just don't know. I've never heard of anybody that has really good mnemonics to remember this, but the only thing I try to remember is clonic is clowning, like a clown's kind of jerking around a little bit. So tonic is the stiffening part of the seizure, and the clonic is the jerking part of the seizure. And then one other thing to remember is that patients can have an aura before the seizure. So some patients, like, if not everybody that has seizures has an aura, but if they do, they might say they have a metallic taste in their mouth or they smell something funny. And some auras are visual, so they can see spots in their eyes or have floaters in their eyes, and they know that they're going to have a seizure. So an aura is a symptom patients experience before a seizure. And one last thing to talk about in neurologic emergencies is migraines. So lots of people, millions of people are afflicted with migraines. There's a bunch of different treatments. It's very painful. People can miss a lot of work. Aside from the really, really bad headaches that they can have nausea. Those are other symptoms. Let me get them rolled off here. Nausea, vomiting, photophobia. Photophobia is when light bothers you. So if they're in a dark room, they're fine. And if someone comes in and turns on the lights, they'll go, ah, and they can't handle it. So they don't like loud noises or bright lights. So photophobia. There can be some visual impairment. Sometimes people can have auras, just like auras with a seizure. They can have an aura and know that they're going to have a stroke or going to have, sorry, a migraine. And then obviously headache. And the treatment for seizures, there's not a lot of things that EMTs can do pre-hospital for seizures, but we want to put the patient in the position of comfort. So we want them to be in semi-Fowlers. That's probably semi-Fowlers position. It's probably what they're going to prefer. So you don't want to be sitting straight up, and you definitely don't want to be laying all the way flat when you have a seizure. And then avoid bright lights. That's all we can really do in transport to the hospital if they are requesting that. Okay, so that is my recording for neurologic emergencies. I will publish this to my students on Canvas, this Word document for review. And as always, email me or contact me if you have any questions or concerns.